Hi, everybody. I'm Vineet Kulati, founder and CEO of HealthExpense. Started this company about 4 years back through a deep personal experience. My dad, who's 83, at the age of 49, required a heart bypass surgery. And at that time in India, the mortality rate for that particular procedure was over 90%. There was only one hospital, this is 30 plus years back, who actually performed the procedure. So we made a decision to have the care be done outside India, and I personally spent several cycles calling providers in US, Canada, Australia, England, not to look for the low cost of care, but to really identify how we were going to deal with this significant payment obligation, and did that twice over 10 years. And fast forward, 25 years plus, started HealthExpense. And really what HealthExpense focuses on is what I call the single largest and biggest challenge in healthcare today, which is the emerging and significant payment responsibility that individual consumers have to handle. The new payer in healthcare is not the insurer. It's not the employer, it's the individual consumer. They are handling probably one of the largest healthcare burdens, very much like I had to go through with my family 30 years back, is that payment burden is growing year on year, and today represents about $400 billion in healthcare payments are done in the form of out-of-pocket payments by consumer. And this is just US information only. This is not global information. This number is trending to grow to over $600 billion in out-of-pocket payments from consumers by 2019. What we also see is not just the numbers, it's the burden of financial planning, burden of payments, burden of financial savings that are going to be required by families, by people as they age, by young people if they are starting to think about future costs as well. The underlying challenge and the fragmentation in the healthcare system, in the insurance system, in the employer-based benefit market leads a fair amount of confusion, leads a significant amount of challenge when it comes to really solving this real-world problem. It's not just about the burden of money that you handle, it's how you have to handle that information. Over 42 million people suffer from the challenge of unpaid medical bills. It's not about the bankruptcies and the personal human story that accompanies it, but fundamentally it is an information and technology and a process problem that we have to look at and have to solve as well. And that's the core focus of HealthExpense. That's really what we do day in, day out, is to see how we can aggregate, assimilate, digest, present an information that allows consumers to not only manage and save on their healthcare costs today, but also consider this as a financial planning vehicle for the future as well. The Wall Street Journal, tons of newspaper articles, tons of different studies have said, even the experts, even we have trouble sometimes understanding what the insurers provide in terms of explanation of benefits, in terms of claims information. There is tremendous amount of complexity in there. There's tremendous amount of complexity in terms of how providers publish this information. So what really comes down to is not just the information problem. There is a looming crisis and a looming challenge. One of our clients, Fidelity, actually published this information among other banks as well, where they said that post-retirement, an average American couple is going to require over $250,000 in just healthcare cost management. That's the second largest spend and savings category that you will have after your 401k and your retirement assets. It's a generational shift. For those folks who've been in healthcare, for those folks who've been in insurance, the current market for group-based plans is changing permanently from groups to individual consumers as well. And if you think about how you need to save, how you need to pay for those healthcare expenses, the health savings account, the HSA, is the only other tax advantage instrument that exists today outside of your 401k. That's the only savings vehicle that allows you to put pre-tax savings into your health savings account. As an individual employee, as a consumer, it's a portable asset. It carries with you from employer to employer. It carries with you from customer to customer as well. And there are very few people learn how to save. So what do? We really focus on providing information to control the spend and savings, creating clarity in terms of what you owe, how you need to pay, and making that information accessible at any given point, whether it's on your web, mobile, and on through communications as well. So HealthExpense is really an integrated, completely consumer-directed, focused pay and save platform. Once you connect your insurance carrier, we cover 90% of the insurance carriers in the country today. We're capturing over $1 billion in claims asset, $100 million on a monthly basis. You have a lifetime vault. You have a single view of your spend, and you can actually pay and manage your healthcare expenses and save through the platform itself. How we go to market, how we create those relationships is to really surround this new pair with a significant set of partnerships. Today, we are partnered with 2 out of the top 5 health savings account financial institutions, some of the largest third-party administrators. Connecting the provider, the doctor, the hospital to this payment system, it really weaves together the infrastructure that's needed to support this new consumer, all the way from cost tracking to payments to savings as well. So our focus has always been enterprise to consumer. We create those payer-based relationships, change the way their members manage healthcare costs, health benefits, and payments directly through our platform. Creating convenience, a single place, making the consumer, the member engaged in their health decisions is a significant part of that focus for HealthExpense as well. Today, we're making payments across the nation. This chart just represents the scale volume of individual payments across the nation just in the last quarter alone. It shows an underlying need for a singular solution like PayPal for healthcare to connect the payer, the administrator, the employer, the financial institution, all for the consumer to drive payments and savings. And that's really where the payment network comes in, because we can settle those payments as an entity directly to the provider, solve the biggest problem that doctors have, is that they cannot recoup money from patients who once received care and leave the provider's office as well. We'll look forward to actually walking you through the solution. We're set up at the booth there, and I'll just pause and ask if there are any questions. Thank you.
Thank you. Any questions? That usually means the presentation was just that good. But no questions? Okay, so they're going to be there at the booth anyway, so feel free to ask them any questions that you might feel like you want to ask personally, not publicly. So, yeah. They're going to be there. Thank you.
Thanks, Ali.